Welcome to Rural Health and Health Equity, Unit 1 of a 2-unit module. I'm Diana Scow, an assistant professor in the Department of Community and Public Health at Idaho State University. I also direct Idaho's area health education centers. Our mission is to create a diverse and sustainable healthcare workforce for rural and underserved areas in the state. I grew up in rural areas in the western United States, and rural is one of my favorite subjects. Today, we'll talk about rural Idaho, an absolutely beautiful place to be. By the end of these units, you will have a better understanding of some of the challenges and opportunities that come with creating health equity while addressing infectious diseases in our state. You will be able to explain the importance of addressing health equity, identify initiatives that address health equity, and know where to go for and how to share resources with others. To get us started, we first need to be able to define what rural actually is in the United States. And this is super important because of how different government organizations actually define rural. It determines who will get access to very important dollars and other resources. These dollars and resources can help communities address the social determinants of health. They can also help support programs like health workforce development. They can increase capacity for fiber and other means of providing internet connectivity, and they can improve technology for telehealth services. Also, they can even support infrastructure development to ensure safer, more reliable transportation and transportation routes so people can get to the health care that they really need. There are 3 common factors that government organizations use to determine whether or not an area is rural. These are population, housing units, and geography. When coming up with definitions, some questions these organizations ask include: how many people are in a particular place? How far are people from an urban populated area? Or how long does it take them to commute to a more populated or urban area? And also, how dense are the housing units in a particular area? Definitions of rural that are commonly used come from the U.S. Census Bureau, the U.S. Department of Agriculture, and the Office of Management and Budget. Depending on which definition is used, a certain community may or may not be rural. Most importantly, and something we should never forget, regardless of how governments define rural, it is people and communities that experience rural, and they are often the best judges of what that really means. A very good tool to help you figure out whether a specific location is rural, based on those government definitions, is the Am I Rural tool. And this is located on the Rural Health Information Hub website. A person can go to this website and enter a city and state and get the information they need. For example, if I type in Aberdeen, Idaho, a report will be generated that tells me what census tract and county the town is located in, and whether or not it meets the definition of rural based on 8 commonly used criteria. For example, like RUCAs, or Rural Urban Commuting Area Codes, or UICs, Urban Influence Codes. You can find more information about these at the Am I Rural site. The report that you can generate will also tell you whether or not the location you entered is a health profession shortage area for primary care providers, like doctors, nurses, and physician assistants, or dentists, or even mental health care providers. Further, it will tell you if the area is eligible for government program support, like support from the Federal Office of Rural Health or Medicare and Medicaid services. If you are in doubt about your location status, the Am I Rural tool is a great place to start. So why does this matter in Idaho? Well, it matters because so much of our state is rural. Recent figures suggest that 33% of our state's population is living in a rural area. Idaho's Bureau of Rural Health and Primary Care states that out of our 44 counties, only 9 of them are designated as urban. That means that they have a population center of at least 20,000 people or more. And while we do have 19 counties designated as rural, we have 16 counties that do not even meet the standards for the definition of rural because there are so few people in them. And those counties are considered frontier. They have 6 or fewer people per square mile. The number of people in Idaho and where they are located greatly affects how they access health services and whether or not they receive those services equitably. In fact, because of changes made to the 2020 census and because of Idaho's rapidly growing population, especially in the Boise area, designations for rural may change as we speak, and that may impact the services people receive. For the time being, we do know this. Idaho is really rural. There are special challenges to consider when thinking about the health equity in rural locations. For example, we don't have enough healthcare providers. The Health Resources and Services Administration says that in 99% of our state, we do not have enough primary care providers. In 96% of our state, we do not have enough dental care providers. And in a full 100% of our state, we do not have enough mental health care providers. That's important because Idaho has an extremely high rate of suicide. Along with the lack of providers comes a lack of locations at which to get care. And in my work, I regularly hear people tell me they must travel more than 2.5 hours to get to the care of a specialist or to even deliver a baby. And that travel time only applies if it's good weather. It takes a longer time to drive 30 miles in a snowstorm than on a clear, sunny day. And have you ever looked up travel time using Google Maps? The estimates of how long it takes to travel on a windy road with no passing lanes are not always accurate on Google. And the estimated times do not account for wildlife that may be a threat to safe driving, especially between dusk and dawn. And while telehealth services are useful, they don't work if you can't get internet. Through fiber or even through cell phone providers, this can be an issue. I regularly drive from Pocatello to Salmon, and when I do, there are numerous places where I cannot get cell service. Finally, let's not forget the challenges that isolation can play in determining health status. Being in a rural area can mean less opportunity for social engagement and the ability to seek social support. While rural communities are often close-knit and they work in wonderful ways to take care of their members, if someone perhaps does not fit into a limited cultural or social ideal or standard, they can be ostracized and have nowhere else to turn. Let's look at Idaho more closely. What are the differences between rural and urban within our state? Are there differences? Yes, indeed there are. In urban areas, income is higher. Poverty rates and unemployment are lower. And the percent of those completing college is much higher in an urban area. Only 24.1% of those from rural areas complete college, compared to 31.5% of those from urban areas. That's a 7.4% difference. That's 7.4 more people out of every 100 completing college in an urban area. And when you think about it, that's 7.4 more people who may have chosen a career in healthcare. So, what are we doing about this issue? Thank heavens Idaho does have those definitions of rural, because they are responsible for bringing super important programs to our state. For example, we have 27 critical access hospitals. These are hospitals that have a smaller number of acute care inpatient beds, and they are essential to ensuring care in rural, smaller locations. We also have 52 rural health clinics, 44 federally qualified health centers, and 2 short-term stay hospitals. These types of clinics are important to providing care for those with lower incomes. It is programs like these that help bridge health equity gaps and provide much-needed care, whether it is for chronic or infectious diseases and illness or other health issues. Idaho also has excellent programs to help strengthen the health workforce, so we can grow our own. Our area health education centers are instrumental in providing future and existing providers with skills and resources necessary to ensure their success in working in rural and underserved areas. With 1 central office and 3 centers, we are able to reach students from all over the state, encouraging them to find a health career path that they love and to stay in Idaho to use it. So that's it for Unit 1. In Unit 2, Dr. Elizabeth Cartwright will be sharing our story of Idaho Communivacs, a project that was designed to address COVID-19 vaccine access and acceptability among the Hispanic population in rural southeastern Idaho.